All right. Welcome to this session. We are going to discuss about the life course perspective or approach. Um, what is this all about, and how can we actually apply it in public health? The life course approach looks at the different factors that that happen across our lives and generation, and how they influence reproductive health. We can broaden it further and say health in general. But this discussion basically is in the perspective of reproductive health. So we look at someone's entire life, okay, and see the progress that they make, or we relate actually the experiences of one's life, and the experiences that one has had, and then relate them to the reproductive health outcome. So we examine these factors and look at how these factors bring about better reproductive health outcomes, or how they relate to poor reproductive health outcomes. So, of course, these factors are very many. They are biological, they are social, they are behavioral in nature, but all of them ultimately influence health outcomes. So it gives us a wide view of what health is and what influences health. So Michael Marmot believes that um, the health outcomes that one experiences as a result of accumulation of all these positive and negative health impacts that they have had throughout. Uh, so these impacts have cumulative effects, such they interact with these impacts actually interact and then produce a cumulative kind of impact or effect. Why is it very important that we actually adopt this? It looks at the fact that every health condition is associated with certain fundamental causes. And looking at these um, causes at different levels actually maximizes the impact of the interventions that we have. So it's a very good way to implement interventions. Implementing interventions that are based upon the life course approach is actually very useful, because there are studies have shown that they have great potential to reduce the burden of disease. However, although this is actually a perspective that uh, has gained prominence in public health, there are issues um, related to how it can be implemented. Of course, not very many people will understand this perspective. Politicians may not have the will to look at this. But of course, the other thing is that there are a lot of determinants, okay, with the economic, environmental, genetic. So it could be very hard to really address all of them. But it also requires a strong health system in order to address some of these issues. It is very vital to look at the performance of the health system overall. If you have a weak health system, it is very hard to address these underlying determinants of health across the life span. This is a perspective that the health workers actually need to really think think about, or they need to be trained about. They need to be reoriented in terms of thinking, because often what we see is that the training of health workers is towards them delivering care, which definitely is not incorporating the perspective of addressing these the underlying factors that cause people to come to health care, to healthcare facilities for treatment of different diseases. Um, so in the context of reproductive health, it presents us with an opportunity to look at care in terms of continuity, from the unborn child up to adulthood. This perspective helps us to look at the different reproductive health needs of the different of people across different stages of the lifespan. So it helps in ensuring that we move health needs, I mean health services or reproductive health services, to actually to people where they actually need these services. Okay, it's about understanding that the different categories of people may actually need services in different kind of setting, whether it is household, communities, or even health facilities. So it gives us that wide view of looking at the care that we actually provide. Thank you very much.